I am Roberto Santamaría, your host this evening for Nantucket Pulse programming made possible by Nantucket Cottage Hospital's Community Health Initiative. This is a special edition of the Nantucket Pulse programming that will air weekly, covering the impacts of coronaviruses for the island and will provide urgent updates as they unfold. Same problem. I hope you and your family are doing well and staying healthy. Keep going. Keep going. We at Nantucket's Incident Response Team are very busy, but want to take a moment to applaud the community's dedication to social distancing. We especially want to thank our healthcare workers and support staff at the hospital for keeping safe 30 miles out to sea. It plays a huge part in the reason we on Nantucket have only 10 confirmed cases on the island. For reference, Martha's Vineyard has 9 and the Cape 314. Let's start tonight's community updates in Washington, D.C. and make our way to Boston, to Nantucket Town, and then we'll end with Mid-Island. The Department of Homeland Security has temporarily paused on issuing H-2B visas until further notice. According to Cape Cod Times, the Federal Bureau of Education and Cultural Affairs is strongly recommending all J-1 visas be suspended until mid-May. On March 28, President Trump approved a major disaster declaration for Massachusetts. This designation directs the Federal Emergency Management Agency to cover 75% of state and local government costs associated with COVID-19, the COVID-19 response and emergency protective measures. Funding has also been set aside for the Massachusetts Department of Mental Health to offer support over the telephone to individuals and families facing a crisis at this time. To connect 24/7, please call the following phone number at 1-877-382-1609. Through the Caregiver Advice Record and Enable, or the CARE Act, the Small Business Administration is offering a $10,000 grant, which means you do not have to repay it, to small businesses called a loan advance as part of the Economic Injury Disaster Loan. Your small business can apply for a loan of up to $2 million at 3.75% interest or 2.75% interest for nonprofits, and then also ask for this loan advance. According to U.S. Senator Brian Schatz, a proponent of the bill that created this program, the grant will come within 3 days of receiving your application, even if your loan application is denied. To qualify, applicants must be a small business with 500 or fewer employees, small agricultural cooperative, sole proprietorship, independent contractor, cooperative, or an employee-owned business, or private nonprofit of any size. Additionally, the organization must have been in business as of January 31st, 2020, and must demonstrate economic hardship due to COVID-19. The CARE Act also has created loan forgiveness programs called the Paycheck Protection Program, or PPP. Businesses are eligible if 75% of their Small Business Administration loan is used for payroll, and the rest is spent on mortgage interest, utilities, and a few other expenses during the 8 weeks after the loan is granted. To apply, visit the link at the bottom of your screen and in the description. The deadline for state ID cards, which includes driver's licenses, to be Real ID certified has been pushed back by the Department of Homeland Security until October of 2021. Governor Charlie Baker has extended the closure of non-essential businesses until May 4th. He expanded the list of essential businesses that are allowed to come to work to include supply chain workers that support essential services, healthcare workers like chiropractors and optometrists, hotels, motels who only cater to essential COVID-19 workers, and more. You may find the full list at the link appearing at the bottom of your screen and in the description. A new pilot program has started in Cambridge, Massachusetts that provides COVID-19 testing through the Massachusetts National Guard nursing homes. Usually, nursing home residents must travel to a physician's office for a test. The state plans to expand the program based on the Cambridge operation. In an effort to increase the number of medical professionals, the state is expediting the licensing of certain healthcare workers who sign up at the state volunteer portal. The link is at the bottom of your screen and in the description. More than 1,800 volunteers have signed up statewide. In addition, the Beacon Hill is enlisting individuals who are about to start their medical care and those that chose to end it. Officials are granting qualified fourth-year medical students 90-day limited licenses to practice medicine immediately. The Department of Public Health is rushing the reinstatement of the Massachusetts medical licenses of healthcare workers that let them expire in the last 10 years while in good standing. In order to help protect our hospitals, the state created a web portal to provide a central place for companies and individuals to donate personal protective equipment to the state's healthcare workers that need it the most. Items like gloves, N95 masks, protective suits, gowns, hand sanitizer, and more all make a big difference. The link is at the bottom of your screen and in the description. A new state website named Buoy offers free advice to individuals about what their symptoms might suggest and what type of medical care they should consider. The link is at the bottom of the screen and in the description. Recreational marijuana sales have been suspended. Only medical dispensaries are allowed to remain open. The reason is that Massachusetts is one of the few states in the region to permit recreational sales. The governor does not want customers from other states to come into Massachusetts to buy these products. The April 15th deadline for state taxes has been pushed back to match the new federal deadline of July 15th. All travelers arriving in Massachusetts are instructed to self-quarantine for 14 days. This past Saturday, additional state police officers arrived on island, and on Tuesday afternoon, 4 Massachusetts National Guard members arrived on Strait Wharf. They came to provide additional security for the hospital, which does not have its own security, and to perform other duties like directing traffic in the parking lot. They will not enforce federal laws like immigration restrictions. Compared to this time last year, ferry traffic is down sharply. The Steamship Authority's reduced schedule will now continue until May 5th. It can be found at the link in the description. Chief Pittman says that police officers have noticed just a few dozen people disembarking the ferries they've observed. The NCTV crew was working at the Steamship Authority ferry terminal at 8 a.m. on Tuesday when the boats arrived. Only a handful of trucks drove off and 1 passenger walked off the gangway. Between the decrease in passengers and the stay-at-home advisory, a stillness hangs over the streets in town. The activity in these shots taken on Tuesday seems more at place in Sconset than in town at this time of year. Essential workers trickle in, and an occasional jogger will dart down a sidewalk. The police make regular patrols as we are hunkered down. One house shared some encouraging words of wisdom. This past Wednesday, the Select Board debated language in Emergency Order No. 1, which instituted a moratorium on all construction and landscaping. The state's stay-at-home advisory did not ban construction and landscaping, but it later clarified local boards of health can institute further restrictions. Nantucket's temporary ban on construction and landscaping remains valid. However, some of the final wording has left room for confusion. It allowed exceptions as one person were to work on an unoccupied building. This intention was for essential workers that did not require deliveries of materials. Many construction and landscaping businesses inquired if their workers could follow a rotating schedule that would only put 1 worker at a job site at a time. Town manager, Libby Gibson, called this interpretation problematic and said it had opened up the floodgates again in terms of workers coming to the island. In response, the Select Board responded no to the questions about rotations of single workers. Yesterday, the Board of Health voted to change the language in Emergency Order No. 1 to prevent any confusion about this issue. Only with approval from the Building Commissioner for construction jobs or from DPW for road work with essential work being allowed. Essential work must protect the health of Nantucketers or provide critical support to the property. If you are a homeowner that requires an emergency repair, please call the Nantucket Building Commissioner. I don't know when this moratorium will be lifted. As Anthony Fauci, director of the National Institute of Allergies and Infectious Disease, says, we don't make the timeline. The virus does. Town meeting has been pushed to May 30th at 9 a.m. The town election has been pushed back to Tuesday, June 16th. Please note that if you submitted an absentee ballot before voting day, whenever that will be, your vote still counts. Not only that, but you can change your vote by showing up to the polls on election day. Anyone that claims fear of COVID-19 contamination as a reason for an absentee ballot will be granted one. The infection rate of the island has been described by Nantucket Cottage Hospital's CEO and president, Gary Shaw, as the outer bands of a hurricane. The relatively low number could spike quickly if the community stops social distancing practices. The hospital is advising everyone to stay in their houses of those that tested positive for COVID-19 to self-quarantine as if they tested positive as well. Officials believe there is a viral pool that is circulating around those in contact with patients. Mr. Shaw has been pleased with the response so far. He said during the select board meeting this Wednesday, "We have the most dedicated medical professionals I have ever worked with. They're prepared to address everything we can with the small facility and equipment we have. But that is not enough to take care of hundreds of people if we have a surge in cases. And we have to rapidly hospitalize people." End quote. Tonight at 7 p.m., the hospital is joining other hospitals across the state in an effort to recognize everyone, not just the healthcare workers, but first responders, grocery store employees, truck drivers, and all the other essential workers keeping things running. Join the hospital in saluting them across the island and beyond with a collective round of applause from your house or window at 7 p.m. The Nantucket Board of Health has postponed their inspections of restaurants wanting to open. The workload due to the viral outbreak prevents them from offering this service. The inspections will resume at the earliest opportunity. This is a reminder that the island's drugstores are still open. Dan's Pharmacy opens 9 a.m. to 6 p.m. Monday through Saturday and 10 a.m. to 2 p.m. on Sundays. Call ahead at 508-825-9100 to arrange an outside pickup or home delivery. Island Pharmacy allows a limited number of customers into their locations, with social distancing observed, and will bring items outside for curbside pickup. If customers have arrived on island within the past 15 days, Island Pharmacy will deliver to the outside of their home. Their hours are 8 a.m. to 6 p.m. Monday through Friday, and until 5 p.m. on Saturday. Call them at 508-228-6400. Nantucket Pharmacy is open 8 a.m. to 6 p.m. 7 days a week, except that they close at 5 p.m. on Sundays. Although the store is open, if they do not recognize you, they will ask that you wait while a shopkeeper grabs what you want. If you are sick, they ask that you please call them at 508-228-0180, and they will deliver to your house for free. They also offer curbside delivery. Unfortunately, the disc golf course in the state forest has been closed for the first time to encourage social distancing. To see a nearly complete list of which businesses are open and which have modified schedules, please visit Yesterday's Islands link at the bottom of this page and in the description. The town maintains an emergency COVID-19 alert system that will send messages to your phone. To sign up, please visit the link at the bottom of the screen and in the description. Finally, let's end with the school. They have been following guidelines set forth by Governor Baker to remain closed until at least May 4th. Starting next Monday, all students will officially be following lesson plans. The administrative team and the staff have been working hard at creating plans for all the students from kindergarten to 12th grade. Many high school teachers and advisors have already been connecting with their students, and so have the teachers in the lower schools as well. They are using a variety of remote learning tools such as Google Meet and Zoom. It is not the school's intention that any student should repeat a grade. Lessons and content are being designed to continue learning remotely at a moderate pace in order to keep students on schedule. A big uncertainty is the Massachusetts Comprehensive Assessment Systems Test, or the MCAS. The Department of Education and the Commissioner of Education will decide soon for the state whether or not to administer this test this year. The test is required for high school graduation. Now, I would like to welcome back a regular guest to this program, Nantucket Cottage Hospital's CEO and President, Gary Shaw. He is going to share a statement from the hospital and then take questions from the viewers via YouTube chat. Hello, Gary.
Hey, Roberto. Thanks for having me.
Absolutely, anytime.
All right. Well, while they're adjusting cameras here, just a couple of words. I want to say thank you to Dr. Diane Pearl and all of the staff at the Cottage Hospital for the work that they've been doing. I wanted to have Diane here tonight with me, but more than that, I wanted her to have a night off. Folks are getting tired, as I'm sure others are in the community, trying to prepare and do the good work that they do every day. So thank you, Diane. Thank you to all of the other physicians and staff at the Cottage Hospital for the work that you're doing. Wanted to read a little statement tonight about the current situation and let you know, as Roberto had said, that we now have 10 positive cases of COVID-19 on the island. And while this may seem like a relatively small number, we want to emphasize that the coronavirus threat is still really very real. Vigilance is imperative, and we must continue to stay at home and practice physical distancing at all costs and adhere to all of the measures put in place to protect our community. For most of the COVID-19 cases we have confirmed, we know of presumed positive family members and social contacts who are appropriately quarantined but not counted in the total number of confirmed cases. In a household with a COVID-19 positive patient, they have likely already spread the virus to those in close contact before their symptoms developed, and that's just the nature of this disease. So if those people develop symptoms a few days later or not at all, they're presumed to be infected and not necessarily tested. The entire family of a COVID-19 patient is ordered to remain quarantined together for 14 days after exposure, and they receive extensive CDC-issued instructions and guidance to prevent further infection. In addition to being quarantined, contacts of positive patients are instructed to monitor their symptoms and seek help if needed. These individuals are educated on the most current testing indications that are really relative to their particular situation. And sometimes the guidance changes, but we try to keep it updated so those folks can have the best information and stay safe. But clinic judgment always plays a large role. What the physician says to you based on what your illness is, how you're moving through it, is the largest indicator of getting better. We also understand there's a false negative rate to consider. You probably heard that in the news about the COVID-19 testing. And not only do we recommend that those who have tested negative to maintain isolation, we have decided to retest some of the individuals which would show there's a strong suspicion of COVID-19 diagnosis. The bottom line is that the coronavirus is here on our island, and there are almost surely more cases than have been confirmed at the Nantucket Cottage Hospital, and other Massachusetts hospitals are making every effort to expand testing capacity, and our turnaround time on the island has improved. But widespread voluntary testing is unlikely in the short term. While the community spread of the virus on Nantucket is occurring, and we're aware that to date it's not been extensive, but that's only because our town and those of us at the hospital and leadership roles, we've acted early and decisively to protect Nantucket with emergency orders and guidelines around physical distancing. So we urge the community to continue adhering to these critical measures to prevent any further spread on Nantucket in the days and weeks ahead. Please stay home, wash your hands, and limit trips to the grocery store as much as possible. Everyone in the community is making sacrifices during this challenging time, and we appreciate the collective efforts of our island. I'll just end in saying that this is a beatable disease. Thank you.
Yes. And now I guess we'll be moving over to the question and answer session. So for those of you watching on YouTube, if you need to do your question to activate the chat function, sometimes you have to hit your refresh button. So we'll go ahead and do the refresh, and we'll wait a few minutes while we get some questions in. In the meantime, Gary, since while we're waiting for some questions to come in, how do you feel your staff and the island has held up in this? I know we're incredibly proud of our staff as well.
Well, I mean, they're tired.
I can imagine.
I think folks have worked many, many weeks without time off, and we're hopeful that this decrease in caseload that we're flattening this out, and that people can get some rest. That's the goal. So, but we're holding in there. We're leaning into it. We know there's a light at the end of the tunnel, and we're going to be fine.
Absolutely. I imagine that fatigue is a tough one, but we are moving forward. We're definitely moving forward. So we're looking at the potential. This one's from Marlene. Looking at a potential 2 to 3 week peak for our hospital with COVID-19 patient overflow. Is there a plan in place to house patient overflow with beds and ventilators?
So we call that surge, and the surge plan has been designed to look at maximum use of the Cottage hospital. And the planning right now looks at an overflow scenario of staffing up to about 22 of those beds. We have the opportunity to grow larger, but to do that, we're still evolving plans that look at staffing for that capacity. The main focus is to have as many people as we can that really need significant treatment with ventilators to be taken off island to the shore, where there's facilities that are larger that can help with any of the urgency that occurs in an acute ICU situation. So combined with what we're thinking of doing at the medical center of expanding and then having a surge capacity that goes offshore, that's the plan. And right now the logistics we're working through on are how do you transport people? If you have large numbers, how do you do that safely and successfully? So that's still an evolving target.
I can imagine it's a difficult time, and planning for surge is never easy. It's not a contingency plan we want to ever activate. So another one from Marlene. The Board of Health emergency broadcast on April 2nd mentioned false negative COVID testings. Can you elaborate on this, and what do they mean?
Well, in all tests, there's a percentage of accuracy, and the accuracy of testing gets better as we know more about a disease. In this case, it's felt that false negatives can occur through sampling techniques, but we don't know for sure if the false negative is completely technique or just the sensitivity of the test in its early stages of development. But that then leads us clinically to make decisions on whether we retest individuals to see if we get another false negative or a positive.
Absolutely. I remember back in school we had to do NPV and PPV calculations for specificity and sensitivity. So I remember that's a pretty complicated process. And then lastly, are there any new updates on symptoms for COVID-19? If there are, what are they?
Yeah, not that I'm aware of. That would be a Dr. Pearl question. But we know they're upper respiratory. That's well documented. There is some information now that is starting to emerge that talks about gastrointestinal impact. But I haven't read anything that says that that's a normal presentation. So I think the next time I come, I'll have Diane with me, and she'll be able to answer that more specifically.
Sounds good. Well, Gary Shaw, President of the hospital, we really appreciate it. Thank you, as always, for everything you do and for taking time out of your busy day, especially on the end of the day on a Friday. We really appreciate this. Thank you very much.
Thank you, Roberto. I do want to tell the viewers that I think you are doing one fantastic job of holding the line and social distancing. I see it in an example of it wherever I travel. thank you for doing that. Please continue doing it, and we will get through this. I promise you. Social distancing, physical distancing works. Please keep it up, and we'll come through, and you'll see the light at the end of the tunnel. Thank you.
Thank you, Gary. And now we'll be moving over to the Meals on Wheels delivery. We have a pre-recorded interview with Nick Nashington, Jamie Nass, and Taylor Hills from my office for the new senior program. So we'll be back live when that is completed. Thank you. So if you could give me a quick overview on how this new program and how all this came to be. We really appreciate everything. So Taylor and Jamie, Nick, go ahead, take it away.
I could start. So as a team of myself, Jamie, Manny Rojas, George Kelly, and Emily Kelly, our business partners, we wanted to help out during this time and help our community that's been so helpful to us. And we reached out to the town of Nantucket, Greg Tiven, Jason Bridges, yourself, Roberto, and we asked what we could do to help, and they set us up with Taylor, and we mentioned helping out other people, and I know Taylor was all for that, and she got the ball rolling.
They basically wanted to know what can we do to help the most, and in thinking about our island's elders, who are always our most venerable, but right now they're also our most vulnerable, and how could we help those seniors that we want to be staying at home but don't qualify for Meals on Wheels and aren't receiving those services. So we put together this programming that focuses on elders. It's the only requirement to qualify. All you need to be is 60 plus and living at home, and you can get a beautiful meal prepared for you by Sandbar / or the Whale delivered to your house by either these guys or another volunteer Monday through Friday. And the feedback that we've gotten from the seniors is just incredible. One quote that I heard today was that they feel, one couple feels like they're being nourished emotionally as well as nutritionally. And it's just awesome.
That's excellent. That's really great. Jamie, got a question for you. Is there a limit to how much food an individual can receive? Can he or she receive food for a spouse that's not 60 or older yet?
Well, we package them individually. So we kind of give an individual portion size. We do try to keep it 60 and above. If we have extras, we are more than happy to, provide that to our community members. We haven't really had an issue with capping the limit of how many people per day, but the most we've done so far is 52 in one day, which was yesterday, so that was exciting. The program's growing. It's definitely caught a lot of traction right off the rip, actually. But we've been really fortunate that we've had some drivers, some volunteers helping us drive. We typically have around 6 or 7 volunteers helping us drive. So it could take about like half an hour, 40 minutes for each person, and that works much better.
52, you said?
Yeah.
52, wow, that's impressive. Nick, got a question. What type of meals are made for this? And if I wanted like fish and chips, can I make a request for that?
We haven't got there yet. We haven't started doing requests, but we are. We have had certain requests like vegetarians and people that don't eat dairy, and we accommodate for that. We're trying to do a protein, a starch, and a vegetable. An example was yesterday, maybe our most popular meal we've done so far was meatloaf, mashed potatoes, and broccoli.
So can you run us by how you're avoiding any sort of COVID contamination, how you can prevent that contactless delivery?
So we are limiting the number of people in the kitchen. You are recycling gloves constantly, so using gloves. And we are actually, so for our delivery people, we leave the food outside the restaurant, so no one comes into the restaurant. and they have a different bag every day that the food is put in. The containers are not reused. They're new containers every day. We give out gloves to our delivery people, and they should have a hand sanitizer in their car as well. So every time they drop off, if they knock, they can sanitize and then switch it out.
Another thing we're doing is at the call center, they're getting instructions how to leave it outside. So it's kind of like a ding dong ditch. We knock on the door, we leave the food where they want it to be, and then they come and get it whenever they want. So there's no interaction with our elders.
Additionally, when someone calls in, we screen for allergies and restrictions. If someone had a gluten allergy, if someone had, a swallowing issue and could only eat soft food, that's all part of our questionnaire.
Actually, Taylor, that brings up a good point. Can you run us through the process on how somebody would be able to get a hold of this?
Absolutely. So anyone who's 60 plus, interested and living at home can call the Saltmarsh Senior Center. That's 508-228-4490 between 9 and noon, Monday through Friday, and speak with our program coordinator, Laura Stewart. And she'll run you through the questionnaire. She gets what the meal is the day before from Nick and Jamie. So she'll get your address, where you would like it left, if it's just you or you and a spouse, and have you take her through all of your restrictions, allergies, anything like that, so we can keep this as safe and contact-free as possible. And we do ask that people call in every day. So let's say someone knew that they were going to want a meal Monday through Friday, they would still be asked to call Monday through Friday just to verify that the meal was something that they could eat and the same number of meals, so on and so forth.
Yeah, I'd like to give a special thanks to the volunteers that reached out to me, most of them. Once we started posting things on social media, other friends from other restaurants, people from Proprietor, Sea Grill, Crew, other people we work with at Or the Whale, they've all reached out and they wanted to help us. Even today, the last couple of days, Erin Zurcher, chef owner of Crew, she's been making the food, preparing it at the Beat with Amy Young's help. So just the amount of people that have been coming out to help us and make this so much easier it's been amazing. It's really great to see.
So if you do want to donate towards this program, so you go to the Community Foundation website. There is a Nantucket Fund for Emergency Relief. And in the notes, in the memo, just make sure you put in the food program or food initiative, and then you can donate directly through there. We are working out a way so that we can all kind of cover the costs and keep this sustainable going through the entirety of the period that we are on a shelter in place and potentially having to social distance. So if you would like to, that's where you can find it.
And we're back. So that's really great about the Meals on Wheels program. Though it's not Meals on Wheels, it's the new Elder Meal Services that was created through the Human Services Department. Taylor, Jamie, Nick, we really appreciate the work you're doing, and we really appreciate the hard work. So now we're going to be moving on to a statement. The statement will be given by Kristie Ferrantella, Interim President of the Chamber of Commerce for the island of Nantucket. She will be joining us here via conference call via Zoom. Kristie has been waiting for us patiently while we have gone through our own little technical issues. So, Kristie, are you here? Kristie, great. Thank you for having us here. Thank you for joining us today. We really appreciate it, and we're ready whenever you are. So, thank you.
Thank you, and thank you to NCTV 18 for having me tonight. For anybody who doesn't know me, I'm Kristie Ferrantella. I'm the interim president and CEO of the Nantucket Chamber of Commerce. I know firsthand how difficult this time is for everybody in our community. From restaurants to lodging to cultural programming to construction, everybody has been affected by the COVID-19 outbreak. This is a health crisis that has created an economic crisis. And here at the Chamber, we are working tirelessly to provide you with up-to-date information and resources and help you and your businesses right now. In addition, we're also beginning to envision what a recovery will look like for our community and for our economy. We want to stress that the most important thing right now is to practice social distancing and following the stay-at-home order to prevent the spread of COVID-19 and prevent any stress on our hospital. When the time comes, we want to work with our community and our businesses to determine the safest and best way to open back up our economy. We saw a steep decline in economic output, and we want to see a steep increase when it's safe to do so. We're all in this together, and the Chamber is here to support you. If you have any questions, please do not hesitate to reach out to me. Nantucket has always had a strong business community, and together we will get through this very difficult time. And I just want to thank NCTV 18 and the hospital for having me on tonight, and I look forward to hearing some questions from the community.
Okay. Kristie, thank you so much. We're going to be moving on to the questions here on the YouTube. Once again, if your YouTube questions aren't appearing, please feel free to refresh. And with the questions will be showing up in the chat box on the right of the screen. But while we wait for some questions, Kristie, just a simple question that I know is on a lot of people's minds. Should we if somebody's looking for one of these SBA loans or any of the grants or anything like that, or even just information, what would be the best clearinghouse? Would it be one of the websites? Would it be your phone number? Where should somebody go just for some basic information?
Yeah, so nantucketchamber.org has a COVID website. So it's nantucketchamber.org/COVID-19. And there we've put a ton of business resources as well as community resources. And we're updating it with information from the hospital, the town, 97.7, the INM. We're really trying to be a one-stop shop for everybody. We also have a fact sheet to walk you through all the different SBA loan options, which I'm happy to kind of summarize the two big programs.
Excellent. Well, we'll summarize the two programs. Actually, while you're on the phone, why don't you go ahead? Can you summarize them really quickly now, and then we can go on to the next question?
Of course. Yeah. So one of the biggest ones is the Paycheck Protection Program. It's called the PPP. That is out of the CARES Act that was passed last Friday. And what that is meant to do is to help businesses keep their employees on the payroll. And so this is a program where you would go through your local bank, your local lender, and apply for a loan. The maximum amount is 2.5 times your average monthly payroll for last year. And with this loan, you'd be able to keep your staff hired, and you would be able to get forgiven at the end. Past June 30th, you could have this loan forgiven. So this is really a way for the senators to incentivize businesses to keep people on their payroll and a way to get a forgiven grant. The second program is the SBA Economic Injury Disaster Loan, it's EIDL, or they're calling EIDL. And with this, it's a standard SBA loan with a 30-year fixed interest rate, and you can apply for up to $2 million. One of the biggest benefits of this is when you do the very simple application, one of the steps is to apply for a $10,000 advancement, which would be a grant. And this is up to $10,000. What I heard today is it's $1,000 per employee, up to $10,000. Things are changing quickly. We're trying to get as much information out to businesses as fast as we can.
Okay. And maybe you can answer this question. It's a question from Andrew. Can hotels house essential personnel?
I'd put that question back to you, the Board of Health.
Yeah, so we were just wondering we just wanted to see if there was any information from the Chamber on that. But I do know that as far as the health department and as far as essential services are concerned, those who have essential personnel can stay at a hotel. But I know that hotels aren't supposed to be accepting new reservations right now. But I believe I wasn't sure if there was any more different information from the Chamber as well.
Yeah, I know the governor put out more information yesterday, and right now they cannot accept new reservations, but they could have essential workers, I believe.
Okay. So next question is from Arlene. Can you apply for PPP without payroll, as if you were a freelancer?
So the PPP is available to small businesses and sole proprietors. The application started today. And then next Friday, it will open up for independent contractors and self-employed. And so you could use 8 weeks of quote payroll to pay yourself. But I do recommend everybody be in touch with your accountant, your payroll processing company, lawyers, get expert advice before submitting anything.
That's excellent news. Actually, that is better news than we've thought of, and when we were first hearing about these programs. So that's great. And then lastly, the last question here is, can you apply for both EIDL and PPP?
Yes, so the stipulation is they can't be used for the same program, and you have to apply for EIDL first and then apply for the PPP. The EIDL program is a very simple application, and one of the best things that I've heard about it is that you don't have to take the loan, and you have 6 months to decide. So you can apply right now, and then, if all of this passes and businesses are able to recover without the loan, they don't have to accept it. So what we've been encouraging everybody to do is apply for both programs and determine what's best for your business.
Okay, well, these two programs seem to be incredibly important for the town, for businesses across the United States, and I think it's something that we really need to avail ourselves of while we're here in this difficult time. Well,
definitely.
Kristie, we really appreciate you calling in and taking time out of your day as well. It's definitely a tough time, and we really appreciate you calling in. And is there anything you would like to say before we hang up?
Just if you have any questions, the Chamber is here to help. We're working with a lot of different organizations on the island to determine if there's any other local relief. There's an economic task force. We're putting together a survey that just went out today. So really, we're trying to be the clearinghouse. So if you have any questions about what is somebody else in your industry doing, or what are the resources out there, definitely contact me and my team, and we're here to support you.
Excellent. Excellent. Thank you so much. One last question before it came in from Mark. If you usually start payroll on April 1st, would you still qualify? Seemed like a really timely question considering we're on April 3rd. That's why I was curious.
Yes. So we have been advised that seasonal employers should still apply. And your payroll will be determined on a different segment of the year. Okay. Well, thank you very much. Thank you for calling in. We look forward to hearing good news, and we really hope that island businesses avail themselves of the opportunities. Thank you very much, Kristie Ferrantella. Thank you. Thank you. And now we will be moving to a pre-recorded playout from some Nantucket restaurant owners, Michael Getter from Dune, Gavin Norton from Keepers, and Sabrina Dawson from Keepers. We thank you for pre-recording this message, and we'll be back live when it's completed.
Hi everybody, I'm Michael Getter from Dune Restaurant, and I'm going to answer some questions from Lisa.
So the first question is, how did you hear that your restaurant had to close?
We decided to close the restaurant actually on Sunday, March 15th, prior to the state mandating the closure. We felt socially that it was the responsible thing to do, not to risk any of the staff or any of the guests getting sick. So we decided to close, and then later on that night, the state issued the closing mandate.
So could you tell us what first went through your mind?
It was really bizarre. not knowing anything about it, how long it was going to last, and the concept of closing what is really hard for all of us restaurant workers because we're so used to working, and it was a really big decision for us to make. It would have been nice if I had just left the state to make that decision, but we discussed it with the staff all morning long and came to a consensus that it was time to close. It was very scary and still is very scary.
How is your establishment responding, and what choices have you had to make?
Well, since the restaurant's closed, we've just tried to cut our expenses as much as we can, lower our expenses on any of the utilities, just prepare ourselves for this to take quite some time to rectify itself, and just keeping in contact with the staff and updating them on what's going on, trying to keep morale up a bit. But it's been quite a shift.
And if this continues into the summer, what will you do?
Once I stop crying, I guess it depends on what level it continues into the summer in. If it's still a stay-at-home mandate from the state, that's going to be devastating for us and every restaurant in the state. Restaurants are not built to last without any cash flow. So fortunately, the state is coming in with the payroll protection policy and the CARE Act that was just passed by the state, and the president signed it. So that will help considerably for the next 8 weeks. But beyond that, we don't know what's going to happen. And I'm anticipating the summer being quite slower than last year. Hopefully we'll be surprised, but it's going to take a while for us to get back to normal.
Mm-hmm. And what have you heard from your employees?
They've had questions from me regarding unemployment applications and questions. I've let them know that they can reach me anytime. Everybody's just staying at home and staying out of the public. So just doing what everybody else is doing.
Any closing comments?
Everybody on Nantucket, stay home, stay healthy, wash your hands. I was thinking that this is kind of like a bad Nantucket winter storm where we're used to being in for a little while. It's just that it's never ending. But we'll get through it like we always do. Bye.
How did you hear about that our restaurant had to close?
So Governor Baker, he ordered on Sunday, March 15th that restaurants were going to have to close by Tuesday, March 17th. Prior to this, we already decided on that Sunday night that we were going to close and make that motion towards takeout only. We initially thought we were just going to be doing it for a week just to keep everybody safe. But when the governor made the announcement, we were already doing what he suggested, and we already incorporated the new business model into our everyday routine. So we were ready to go and didn't really think twice about it.
Second question was, what initially went through our mind?
What first went through our minds was that we're not going to close and we're going to stay open because, we have a commitment to our staff and the community. And so we made an announcement via social media that we were in this together, and we believe that we weren't going to give up due to the circumstance whatsoever. We wanted to keep everything as normal as possible, and so that our customers could rely on us and just know that in time of need they could always come to Keepers for dinner. We thought that if we did this, that we'd truly be valued by the community and that we'd earn their trust.
All right, so the third question they asked is, how is your establishment responding? What choices have you had to make?
So Keepers is responding pretty well. We already had takeout implemented into our business before this all happened, so this wasn't an unusual motion for us. We already have an online ordering platform where guests can very easily go in and select their meal from the full menu and had the option of pickup. But we also made a commitment to free delivery, which was new for us. We wanted this to be a big thing so that everybody, was excited about it and was there for us. We want everyone to have the opportunity to be able to get their favorite meals from Keepers and have it delivered to their doorstep for free. And so we chose to do that, as well as open up for 7 nights a week, which we've never done before, but we always have been 5 nights a week for dinner. So this, again, allowed Keepers to be an option every night of the week for everybody on Nantucket. We did pause our takeout lunch schedule, just so that we could focus on dinner and really ramp that up and make that, a great thing for everybody. And we also had to pause our Saturday breakfast. However, we still do takeout breakfast on Sundays.
All right, and so the fourth question, if it continues into the summer, what will you do?
So we posed that question to ourselves. If this does go into summer, what are we going to do? Well, we are going to keep going. If we have to do takeout, then so be it. We'll do our best to promote ourselves and ensure that the value that Keepers can provide for guests is always there, no matter what the season is. So we're going to keep going.
And the last question is, what have you heard from your employees?
Our employees are incredibly understanding, given the situation. Our kitchen staff's amazing. We feel grateful to be able to have them here with us during such an uncharted time. Many of the dining room staff, have other jobs and they still work within the community, with the school system or at the hospital. And so, they're focusing on that, which is very important.
I think it's definitely important to say our staff that is still working, they know how lucky they are that they are working with most of the community kind of without a job, or so it's really great that they're going, we're going, and we're able to kind of help the community and feed everyone that we can. So thank you for the interview, and we hope to talk to you guys soon. Bye.
Thank you.
And we're back. We really appreciate it. Sabrina, Michael, Gavin, you're doing great work for the community, and we really appreciate everything you do. So now moving on to our Nantucket rumor report. So far, we have a rumor is whether or not the Nantucket COVID-19 yields false positives. So as you may have heard Gary and I discussing earlier, every type of test has a certain level, what's called specificity and sensitivity. You can Google specificity and sensitivity, false positive, false negative. You'll hear things called type 1 error, type 2 errors. So what that means is that every type of test has a certain percentage of false negatives or false positives. In this case, what we're trying to find is the true positive. So the confirmatory test of the COVID-19, when you do find positives, they do the confirmatory test to make sure that it is positive. So with approximately 99% accuracy, if it is laboratory confirmed as positive, it is a true positive. The false positives are not necessarily that common. False negatives are a little bit more common in the COVID-19 tests, and we're looking to the laboratories and the organizations in the world are trying to figure out a way to bring that false negative number down. Second rumor is that abdominal pain, diarrhea, vomiting, and digestive issues are associated with this illness. There is some preliminary evidence to suggest that. However, it doesn't necessarily change a lot of the criteria for testing here, mainly because it is an upper respiratory illness. And now that we do have local transmission on the island, testing criteria has been, for lack of a better word, relaxed. So the fact that there is some gastrointestinal issues that are now part of the illness, it's not necessarily the primary symptom of concern. So it is, in a nutshell, there's evidence that yes, gastrointestinal is there, but no, it is not the main symptom. The other rumors are, there were definitely some rumors that there were some or not a spike on boats on the last few days. Some information received from both the Highline and the steamship show that in the last couple of days, there were more passengers than there were in the last few weeks. The show tells us that, yes, there was a small spike in boat passengers, but that can be for numerous reasons. It could be because people knew that as you're looking outside, the weather is a little rough, and boats today on Friday, April 3rd, have been canceled for basically the whole day. The storm that we're dealing with right now, people knew was coming, so some people were trying to get on the island before the storm came. But those are the only 3 rumors that we've been hearing so far. If you do hear of more rumors that you would like us to debunk or confirm, please feel free to email at info@nctv18.org. And then moving forward from the rumor report, some questions and answers again with myself. Once again, you have the YouTube questions, but there have been questions that were emailed to that info email address. So I'll go down that list, and then from there we'll move on to YouTube. So the first question is from Mary, that on the next segment, could I, Roberto, address the question of whether the test results are producing false negatives, with only 6 to 81 returned tests showing positive results, even though presumably all the people tested showed symptoms severe enough to qualify for testing. A 91% negative result seems highly suspect. And you're absolutely right. I just addressed that in the rumor report about the false negatives, but it is always important to reiterate that with any type of test, a certain level of false negatives and false positives do happen. Is it also, another question from Mary, is it also correct that no one has been med-flighted off for COVID-19? Unfortunately, that is not correct, but more information on that, we are prohibited to give more information on that to protect patient privacy by HIPAA, the HIPAA Act, the Healthcare Insurance Portability and Accessibility Act. So we cannot provide more information than that. My apologies. The next question is from Heather. Can this be discussed on Wednesday, as in how to not let our beaches and trails be closed on a year-round community? So the governor's order to close the parking lots for the beaches were the beaches controlled by just the state of Massachusetts, DCR beaches. Those beaches, it does not close trails or beaches on private property like land bank or NCF property or even the Nantucket Land Trust. That is up to the property owner whether or not they would like to close those beaches. The governor's order to close the beach parking lots does not affect Nantucket. It's also from Heather, can we speak to the rumors about Tylenol and COVID-19? So there are rumors about ibuprofen, acetaminophen, and acetylsalicylic acid. So ibuprofen is Aleve, Tylenol is acetaminophen, and acetylsalicylic acid is aspirin, Bayer aspirin, Merck aspirin, things like that. So what we're finding is that aspirin and Tylenol are very good at controlling the pain associated with it. Aspirin has a side effect of being a blood thinner, so it is also really important to pay attention of which NSAID you're using. An NSAID is a non-steroidal anti-inflammatory drug, NSAID. So NSAIDs, all have certain side effects. So aspirin is a blood thinner, so if you are on any sort of blood thinners like warfarin or heparin, you would want to contact your primary care physician before you take aspirin to control any sort of pain. Tylenol, or acetaminophen, if you're buying the generic version, is a very effective fever reducer. So Tylenol is actually really strong at reducing fevers of any type. So it is pretty good at treating pain and the fevers associated with COVID-19 symptoms. There have been no other adverse side effects that have been reported with Tylenol usage. But again, if you do have any sort of underlying condition, you do want to connect with your primary care before you start taking that as a regimen to treat COVID-19 symptoms. And then lastly, ibuprofen or Aleve. We've been hearing a lot of rumors about ibuprofen that it might, because it's an anti-inflammatory, the way ibuprofen works is by reducing the inflammatory response in the body. We've been hearing rumors about how because it's an anti-inflammatory, it might actually exacerbate the symptoms of COVID-19 and make it worse. Some preliminary information coming out today actually kind of debunks that. They've been trying to run tests on that, not necessarily a clinical trial, but anecdotal evidence shows that that is not necessarily true. But we would still suggest avoiding ibuprofen for the time being until more evidence comes to show whether or not that can make the symptoms of COVID-19 worse. And then one last NSAID that I may have forgotten is naproxen sodium. Naproxen sodium is, I actually used the wrong word. Aleve is naproxen sodium. Advil is ibuprofen. Naproxen sodium is another type of NSAID that works by using the sodium-potassium channel in your bloodstream. The only issue with that is that because it has sodium in it, and sodium is a major electrolyte in the body, if you have any sort of high blood pressure issues or any sort of electrolyte imbalance, it might cause an adverse effect there, even though it is very good at preventing pain symptoms. So as always, with any of the NSAIDs, as I've been saying, please contact your primary care to make sure if that course of treatment is good for you. Another question is from Jean. Can businesses opt out of serving customers who are sick during essential services in these time periods? If a company does discriminate, what should people who are ill do? This might be creating some issues for people on island sharing that they are sick. If you do feel that you have been discriminated against by any government, organization or business that is providing an essential service, please contact the Attorney General's office. The certain businesses are not allowed to discriminate due to any sort of illness as defined by the Americans with Disabilities Act, the ADA. In the meantime, until that does work through the system, please contact the COVID response team. You can email the health department generic email at health@nantucket-ma.gov. And then we will try to process your request as soon as we can. But if you do feel you are being have any sort of business discrimination, please contact the Attorney General's office at the state. The next question is from Shane. How is the town considering what Cumberland Farms is still being allocated to make food with no change? Well, allowed to make food. Well, Cumberland Farms has switched to a fully grab-and-go method, and they have marked their floors to prevent any sort of non-compliance with social distance. So what it really comes down to is they're not, the pizzas that they create or things like that you used to be able to just go and grab it or have them pull pizza straight from the hot rack. That is no longer allowed. The hot dog rollers, those aren't there anymore. None of the self-service is there. The grab and go food is still available. That is still allowed. Because they are a convenience store, the governor does define them as an essential service. So they are still allowed to continue the grab and go food. And if you have noticed, if you've been in there anytime lately, you will see that they have also quartered off the coffee section, and now a staff will help you with getting coffee so that you do not do any of your own touching of the equipment. but what their process is going on is still allowed. Question also, it looks like it's from Shane, looking at a potential 2 to 3 week peak for our hospital with COVID-19 patient overflows. What is the plan in place to house patient overflow with beds and ventilators? Gary, I believe, answered that question earlier today. There is processes to look into creating overflow bedding. There are sites in place that we cannot release information on right now until there is more of that spike. But the plans are in place. Memorandums of our understanding have been signed, and there is a plan to create basically a field hospital for surge that Gary described earlier. Should we be wearing any kind of face covering when we go outside of our home? As long as you're not taking away face coverings from our first responders and our caretakers, feel free to create a barrier of your face and the rest of the world. Surgical masks, N95 masks, that sort of the mask that you're hearing about on TV and in the news, those are really important for the hospital to have. Those are essential to take care of hospital care workers. And then the basic mask that you're seeing with the 2 ear loops, we're looking for those who have illness symptoms to definitely wear those. If you have the cloth masks, a lot of those do-it-yourself masks that you're seeing on social media, that you're seeing all the tutorials on how to build and how to create them yourself, if you would like to wear those, absolutely. Any sort of barrier between you and the rest of the world, or the rest of the world come to you, is really the point. It would be really good at helping. When you're uncovered, when your face is uncovered, you're open to all the elements. Any layer, whether it's cotton, whether it's paper masks, anything like that, any layer between the 2 mucous membranes in your nose and in your mouth, that sort of layer creates at least a minimal filter to stop droplets. It will not stop aerosols. So what's really important to understand is a lot of respiratory illnesses are transferred by an aerosol transmission. An N95 mask has a 0.3 micron filter in the cartridge. Viruses like the coronaviruses can be as small as 0.1 microns, maybe even smaller. So they can slip through some of these filters. But filters like the N95, the reason they're called N95 is because the National Institute of Occupational Safety and Health, NIOSH, has certified those masks to block 95% of all the particulate matter in the air, including bacteria and viruses, as long as they are bigger than that micron mesh. However, even if the virus is so small, there is still a chance that those viruses do collect on that cotton filter. So as I said, any sort of barrier will work. The CDC is looking to possibly recommend face masks. They haven't yet. You hear information about South Korea where the whole public was wearing masks. You'll hear information about China, how they were all wearing masks, and then the illnesses dropped completely. Well, one of the things that's really important is that a really important part of that is that in China, the quarantines that were put in place and isolation that was put in place was enforced by military personnel. In the United States, our Constitution doesn't allow us to declare a certain level of martial law without due process. So you cannot expect the government to show up with guns and everything and force you to wear masks, which is what you do see in a lot of other countries. So the most we can do right now is to recommend it. So yes, if you have a mask that you can sterilize, that you can launder, that you can use, anything to cover your face, wear it. Absolutely. It keeps your breath and the droplet and particulates that come out of your mouth from going out into the air, and it prevents the particulates and the droplets coming out of other people's mouths and getting into your mucous membranes. So yes, if you have masks that will not remove the stockpile from the hospital, I would recommend wearing it. Next question is, are there any updates on symptoms, and what are they? As Gary mentioned earlier, there are no updates on the symptoms so far. But really what it comes down to is we have to keep monitoring. Information on COVID-19 is ever changing. It's ever changing. And then the Board of Health, the last question, the Board of Health emergency broadcast, or the second to last question, last question. The Board of Health second emergency broadcast on April 2nd, yesterday, mentioned faulty negative COVID tests. Can you elaborate on this, and what does this mean? I believe I answered that in the first question, that yes, as with any test, there are some false positives and false negatives. So I will refresh the YouTube stream right now and see if there are any questions that have come in while I was reading out these questions. And it does not look like we have any more questions. So I really appreciate you all watching, and thank you again. And we will be closing the question and answer session. So thank you for all the questions. If you have any more questions, please feel free to email them to info@nctv18.org. And we will continue to, and in closing, we will continue to provide you with updates on the coronavirus and its impact for Nantucket. This week, Nantucket Pulse debuted a wellness segment series hosted by Natalie Simonero with our local health professionals on Channel 18 and nctv18.org. Please share this with friends and family. It's designed to connect our viewers with local health professionals that can help us take care of ourselves and others around us. It is important that communications remain in place as events continue to unfold and we all remain connected. It's crucial to get the facts from your local news sources such as the Inquirer and Mirror, 97.7 AC-FM radio, and NCTV Channel 18. I am Roberto Santamaría, the Director of Health and Human Services for the town of Nantucket. We are here to serve you, and we thank you very much for tuning in.